Gentlemen, let me ask you something honestly. What if the problem you've been struggling with for years isn't about low testosterone, weak willpower, or just getting older? What if it's coming from one small area of your body, no bigger than a coin, that's been tight, ignored, and undercirculated for decades? I know that sounds almost too simple, maybe even uncomfortable to think about. But after more than 30 years working with men over 50, I can tell you this with confidence. Some of the most powerful changes in male vitality come from very small, very specific corrections. Not pills, not surgeries, not extreme routines. I'm Dr. Thomas Carter, and today I want to show you one of the most overlooked ways older men can restore blood flow, improve sensitivity, and support stronger performance naturally. Not by forcing the body, but by releasing what's been quietly blocking it. Why performance changes after 50 without warning? Most men are taught to believe that decline is inevitable. Blood flow slows, erections weaken, sensitivity fades, and eventually, pills become the backup plan. But here's what rarely gets explained. Age itself is not the main problem. Restriction is. Years of sitting, years of stress, years of tightening without releasing. All of that tension settles into one place more than anywhere else. The pelvic floor. This group of muscles controls blood flow into the penis, nerve signals for sensation, urinary control, prostate support, and erection firmness and duration. Over time, these muscles become tight and weak at the same time. Think of an old rubber band, pulled tight for years, still stretched but no longer elastic. That's what happens inside the pelvis. The small spot most men never touch but should. Between the scrotum and the anus lies a soft area of tissue that acts like a gateway. It's not a muscle you flex, it's not something you strain, it's a release point. When circulation through this area is restricted, blood vessels narrow, nerves lose sensitivity, erections require more effort. Nighttime recovery weakens. When circulation is restored, warmth returns, sensitivity improves, blood pressure increases naturally, pelvic tension softens, and erections feel fuller and more responsive. Traditional medicine recognized this area centuries ago. Modern anatomy explains why it works. This spot sits directly over vessels and nerves that feed the pelvic organs. When gently stimulated, it sends a signal to the nervous system. It's safe to relax. Blood can flow again. Why gentle massage works better than force? Many men assume improvement requires intensity, hard pressure, strong stimulation, long sessions. That instinct is understandable, but it's backwards. Blood flow improves when tissue softens, not when it's compressed. Aggressive pressure tightens the pelvic floor even more. Gentle pressure encourages release. This is not about sexual stimulation, it's about circulatory restoration. How to do it simply and safely. You don't need special equipment. You don't need strength, just consistency and gentleness. Position. Sit comfortably on the edge of a chair or lie on your back with knees bent. Your body should feel relaxed, not strained. Find the area. Between the scrotum and anus, there is a slightly softer zone. Mild tenderness is normal, sharp pain is not. Pressure. Use 2 fingers. Press with the firmness you'd use to test a ripe piece of fruit. Supportive, not painful. Movement. Small circular motions or gentle press and release.
slow and steady. Time, about 60 seconds. That's it. Once per day. Oils, helpful, not required. Some men like to use natural oils to improve comfort and circulation. Warm them in your hands first. Options many men tolerate well: castor oil for deep tissue support, coconut oil for skin comfort, black seed oil, traditionally used in circulation practices. Oils don't create the benefit, the technique does. They simply make it easier and more comfortable. When to do it? Consistency matters more than timing. That said, 2 times tend to work best. Morning, when circulation and hormones are naturally higher. Evening, to release tension before sleep. Avoid rushing. Avoid multitasking. 1 calm minute is enough. What men usually notice first? This isn't an overnight miracle. It's a gradual reset. Most men report changes in this order: warmth in the pelvic area, less tightness or heaviness, improved bladder comfort, deeper relaxation, stronger nighttime pulses, and more frequent morning firmness. Not forced, not artificial, just the body returning to what it already knows how to do. Why this helps more than pills alone? Medication can temporarily force blood into the penis, but it doesn't fix tension. It doesn't improve nerve responsiveness. It doesn't restore elasticity. When circulation improves naturally, many men find they rely less on external help or respond better when they do use it. The foundation matters. This isn't about shame, it's about maintenance. Some men feel awkward even hearing about this area. That reaction comes from silence, not reality. This part of your body controls walking, sitting, urination, intimacy, and posture. Ignoring it doesn't protect dignity, it erodes it. Caring for it restores function and confidence. A quick reminder: you are not broken, you are not past your prime, and your body hasn't betrayed you. It's been adapting to years of tension. Release the tension and the system responds. Small actions done consistently often outperform drastic measures. Closing thought: if 1 minute a day can help your body breathe again, help blood move again, help sensitivity return, that's not strange, that's smart. Take care of the foundation, and the rest follows. I'm Dr. Thomas Carter, and I'll see you next time.